I just want to say a couple words about our next presenter. We have Katie Strawn, who's coming into the virtual presentation arena with us. And now I wanted to give you a little bit of background about Katie. Katie is the current site medical director for the Multnomah County Student Health Centers. We want to make sure folks know about these health centers and what they do. And that's a big piece of this next presentation here from the Multnomah County Health Department. Katie graduated from the Medical College of Georgia with her BSN, then went on to obtain her doctorate in nursing, as well as her pediatric and family nurse practitioner certification from University of Arizona. She's been a nurse and nurse practitioner for over 18 years in a variety of settings, including neonatal ICU, home health, emergency response nursing, urgent care, case management, research, primary care, and child abuse medical examination. It is a tremendous depth of expertise that she brings to her work. She was a nursing instructor in the United States Peace Corps, serving in Malawi and leading training programs for the country's first intensive care nursing workforce. She's been with Multnomah County for 3 years, and in her current role, she provides both clinical oversight and program development for the 9 student health centers across Multnomah County. So Multnomah County alone, that's 9 student health centers that are there to provide service and help with this situation here. So we really want to make sure that we're highlighting this work. As we saw in Dr. Hilde's presentation at the start of the program this morning, overdose occurrence is on the rise rather dramatically, and we need to know that there are resources we can take advantage of to help stem that tide and reverse things and turn it around. So this becomes critical here as we talk about these harm reduction practices and these type of student health centers. So it's going to be, I think, pretty revealing and cause for optimism. So please join me in welcoming for the next section of our presentation, Katie Strawn.
Thank you, everyone, so much. I apologize that I don't have video, but I wanted to take you through a few slides on what we've done here at Multnomah County and our pediatric primary care centers to do a little bit of work with overdose prevention. I'm going to tell you right now, nothing that I'm going to talk about is earth-shattering. These are hopefully all small, manageable, bite-sized interventions that you all can take back and think about what would make sense for your practice. So next slide. My disclosure, I have the only financial relationship is that I am an employee of Multnomah County. All right, next slide. So my objective for this presentation, and you can move to the next slide, is to I want you to just become acquainted, first of all, with what school-based health centers are. They are, I like to think of them as one of our best kept secrets in the community, but we don't want to be a secret. We'd love for people to better understand what our services are all about and how they can complement your own primary care services and other community services out there. We are working with and have developed a new Narcan screening tool and want to introduce that to you all and understand what impact we've seen not only with the screenings, but also what it means to have naloxone readily available to dispense. I want to talk a little bit about some harm reduction practices that we are doing in a primary care setting and how school-based health centers are positioned to be a strong advocate and resource for the community, and to consider, hoping that after this you guys will consider your current partnerships with your local school-based health centers and how they can partner, as well as what your personal practices can do to just do some basic harm reduction interventions. All right, with that, we will move ahead into next slide. Okay, so just to set the stage around what is school-based health, and I apologize, there's a little bit of delay on the video and the audio, so the slides will move forward. But school-based health, so what we are and what our goals are is really to improve access to affordable primary care or any healthcare and mental health services, and these are for school-aged youth. School-based health centers, we want to provide a patient-centered care for our students and families. and that is regardless of insurance status. We try to reduce costs to the healthcare system in general. One of the big goals that we have is to improve educational outcome because we know that kids who are healthy learn better. And we really want to make sure that we are here not only for the kids, but for the families, understanding that medical appointments and getting to, coordinating your child's health care can be timely, can be difficult, can certainly cut into work, and understanding that, there are some vast inequities around that and really trying to smooth over some of those inequities and address them. So school-based health and what our program looks like and what many programs look like across the state. And just to put this caveat in there, I'm going to speak specifically about Multnomah County school-based health centers. We have been around since the early 80s. And so we have been, we had the real privilege to be a part of the conversations around many of the school-based health centers that are in existence here in Oregon. But what we really built are small sort of micro clinics that are typically embedded directly within the schools themselves. So as Paul mentioned, we have 9 student health centers around Multnomah County. There's 10 total in the county. Our medical sponsor is the county health department, the Multnomah County Health Department, but our centers themselves are located directly within high schools. So in these high schools, there's small pediatricians' offices or primary care offices in the high schools themselves for students to access. Some variation in practices include school-based health centers typically do have a medical sponsor of some sort. Sometimes this could be a hospital system, a private healthcare entity, and then like us, an FQHC or health department or some sort of government health sponsorship. So ours is, again, an FQHC. But what the model really is to have, small primary care services that are directly accessible. These sometimes can be for both patients and families. Ours specifically is just for students. Those are our primary patients, and it's typically a K through 12 population. All right, next slide. So I'm not going to read all these, but just our general school-based health services. There are some variations across different centers, but ours are child, sports, physical, really anything that you can think of with a pediatrician's office, sexual health service and contraception. We can prescribe any medications and do have a partnership with one of our health departments so that we're able to deliver prescription medications either directly to the patient's home, or the patient or the student can come and pick the medications up directly at the school-based health center, or we can send it to an outside pharmacy. Our particular clinics do have full laboratory services, and we do have one clinic that has dental cleaning, sealants, and does dental screenings. And then, of course, we do quite a bit more with various different health screenings. One of the really great things about school-based health is that we also, in addition to the clinical services that we offer, we do educational services. So we go out into the schools several times a year and do various health education, usually partnered with the teachers directly themselves or with the program like the health program, and we can do talks on reproductive health services, general health services, health literacy, and most recently starting to roll out various health topics on substance use, harm prevention practices, education practices. All right, moving forward. Next slide. So as many of you are probably thinking, this sounds like a great resource for Multnomah County, but I don't think that this is available to me, or I've never heard of this. This is, when the slide pops up, you'll actually see that currently we have 88 school-based health centers in the state of Oregon. We have a pretty robust school-based health center system, and they are located in almost every county. So if you find your county, look for where the nearest one is to you. This was last updated earlier this year, so this is pretty up to date. If you're interested in having a school-based health center in your community, certainly you feel free to reach out to me or to your schools themselves. It is, it's a lengthy process, but it's one that it really does benefit many of the students, and we'll talk a little bit more about some of the other things that we are able to do. But they are out there. The school-based health centers are out there and are available to you all. Hopefully, we will only continue to grow these services around the state. All right, moving forward. Next slide. One of the most common myths and misconceptions is that school-based health centers are the same, or student health centers. I use the SBHC and SHC interchangeably, is the differences between us and the school nurse. And just to highlight really quickly, the school nurse is a nurse, and they do really incredible work with triaging accidents and administering medications, screening for barriers. But school-based health centers or student health centers really are primary care offices, primary care clinics, and we do all sorts of different things, which we have already listed. But one of the things that we do know, and there's a lot of evidence around this, is that there are some clear benefits to having both within your community. While it may seem like there are redundancies, they actually complement each other really nicely, both with reduction of emergency room visits, detecting health problems earlier, helping to support especially those with complex medical issues, and in general, improving not only student health, but improving education outcomes as well. Next slide. All right. Just want to touch on eligibility really quickly, so that you all are sort of aware. This is for our centers, but again, some school-based health centers do work with families themselves, but the patients who we're most likely going to see and are most likely going to serve are going to be K through 12. We typically see kids who are coming into kindergarten, and then we'll see children until they graduate, whatever age that may be. And our services in particular are open to any children who live within Multnomah County, or attend a school within Multnomah County. It doesn't have to be both. It can be an either or. And they don't need to be enrolled in any sort of education program. They can be also working towards their GED. They do not have to be engaged in school at all, although certainly what we will do is work towards getting them re-engaged with school if possible. Next slide. So with all that being said, to set that context of what our centers can do, wanted to talk a little bit about how we have chosen to look at overdose prevention. And we really started this work because we had 2 youth in our community overdose, had an accidental overdose. And I think the slides advanced 2 slides, so if you want to move back one. We had 2 children who accidentally overdosed. They bought what they thought was one pill, took it, and the 2 of them passed away that evening alone in their rooms. And that was 2 years ago, was in one of the schools here in the county. And that was really a wake-up call to us. We hadn't really been doing a lot of this work, and we're really interested in how we can better serve this community, and better, knowing that substance use is not necessarily on the rise, but that overdoses are on the rise, and how can we tackle this? I think we sort of had our blinders on a couple of years ago and thinking that this wasn't really going to impact our population, but now we are seeing it, and we were really trying to sort of get ahead of this. So we started planning out what we could do a couple of years ago and how we could really help to address this within our locus of control. So we have a 3-tiered approach to looking at overdose prevention. These are all really harm reduction practices, and we are looking to expand into some other services in the future, which is exciting, and we can talk about in a few minutes. But our approach is really based on improved and advanced screening, focusing on education within the community, and then being able to quickly and easily dispense for anyone who is interested. Next slide. So our screenings, really in the beginning, back 2 years ago, our screenings were based on regular evidence-based screenings. We used the CRAFT or the more traditional expert after they turn 18. I assume that most people are fairly familiar with these questions, but they ask some very general questions about different substance use practices, and how much you engage in those practices. So whether that's alcohol, tobacco, or I believe it refers to them as illegal substances. And so we looked at that, and we looked at what our current prescribing practices were with Narcan. So when we ran that data, it showed that for the past 2 years, so looking back 4 years ago, the past 2 years, we had given out 1 Narcan prescription between the 9 clinics that we serve. And just as a perspective, that's roughly we serve or see we do a little over 5,000 visits per academic year between all of our clinics. So in, over 2 years, about 10,000 visits, we prescribed 1 dose of Narcan. So really felt like our craft screenings were not really getting at the heart of what was going on. We felt like we just weren't asking the right questions. So did some research, did a literature review, and found that we really weren't able to find any kind of screening tool that really was youth-focused, kind of got at what we understand as some of the practices that we see among youth in terms of what kind of what are their first means of use, what types of use they have, what kinds of questions were developmentally appropriate, and came up with a pretty simple 2-question screener. And they're right here on here. Do you think you may be around anyone who uses drugs or medications without a prescription? Are you interested in receiving a prescription for Narcan today? And these are really based on some guiding principles of when you are doing or administering these screenings, and understanding that youth, they prefer and need direct questions. They don't like euphemisms, or they don't understand them, and wanting to just be direct and offer them the opportunity to have choice. So next slide. This is what our tool looks like. This is certainly available to anyone who would like it later on, but the tool just has the 2 questions, and then on the tool itself are instructions. So our current process is that children, and we'll talk a little bit about who gets screened in the next slide, but children who we offer this tool. This is a laminated piece of paper that is in the room itself. We ask them to fill it out, and we actually leave them with the tool and have them, if they have the tool, and then they read over what this means. The most common thing that happens is that we have children say, when we ask them, "Are you interested in receiving a prescription for Narcan?" They ask what is Narcan? And that is really at the heart of this intervention. While we're really proud that we are dispensing more Narcan, what we are, the thing that we're most proud of is that we are able to educate every single client in a one-on-one interaction with what this is, not only with giving a brief verbal introduction to what this is, but also leaving them with this information so that they can read it. So we have both the written literature and then the QR code that just goes over a really quick how to use Narcan and gives a really brief introduction. So we consider these sort of the highlights of what we want to talk about with them, and then leave them with that. So next slide. So what we are doing for all of our clinics is that for every client who is coming in, we're doing a really brief chart review to see if they're currently taking any prescribed opioids, any history of use of opioids, any illicit use of any medication, so any previous history of using any substances, if they were recently discharged from emergency medical care, or if they'd had a positive craft screening or expert in the last year. So if any of those criteria, these children are getting that 2-question naloxone screening. So all 9 clinics are doing this. Next slide. And what we decided to do, since this is not a validated tool, and we couldn't find any tools, is we've set out to actually attempt to prove that this tool is actually one that is useful. So we are closing in on 2 years of data collection to see who it is most appropriate to screen for. So right now, because we have the luxury of having 9 clinics, we have them split. So half of the clinics are doing universal screening for all youth 15 and older during sports physicals or well child checks. So that means that every child who comes into our clinic who is 15 or older receives a Narcan screening, regardless of past history, craft questionnaire, anything. Regardless, at 15 and older, they are being offered the opportunity to receive that Narcan education and potentially a prescription for that. The other group is we're asking that 2-question screener only to use with a moderate or high risk craft score or any of the other criteria there. So we've divided down between universal screening versus looking at screening those who are considered more high risk. Next slide. So very, very, very preliminary findings. Again, we're still running all this data, but what we are seeing right now is that no real big surprise, the clinics that are doing universal screening are seeing a slightly higher increase in Narcan prescriptions. But thus far, we have seen a 1,400% increase in Narcan prescriptions. Now, while that number may seem really impressive, please remember that we had only prescribed 1 in the 2 years prior. So it's not as impressive when you think about that. Pretty much anything is a pretty impressive increase in prescriptions. But either way, bottom line is we are definitely getting more Narcan out into the hands of youth and again, while that's wonderful, really one of our big goals is to make sure that we have that opportunity for education, which is usually under 60 seconds. And then they have the chance to have both written and video instructions to follow up with later. Okay, next slide. So a little further on the other types of education that we're doing. So moving from screening into that education, as I already mentioned, we have the actual screener has information on it. We send that piece of paper home with them. We have just another sheet of paper that doesn't have the 2 questions on it, but just has those general information that we found to be most pertinent. We also have little wallet cards and have a little campaign, just like a 1, 2, 3 of what you do, assessing, whether or not they're breathing, administering Narcan, and then calling 911. And then they watch a 2-minute video on administration. So everybody who agrees to have a Narcan prescription gets at least the basics of these 3 fundamental pieces of education. We do have the opportunity if kids say they're interested and they are willing to come back. If we are running tight on time, we'll have the kids come back and just do a visit that includes this education piece. Or we also have a community health worker that is educated or that is trained to provide this education as well. And we are looking at potentially expanding that out into our behavioral health providers being able to provide that education in addition to our CHWs and providers. The other prong of the education approach that we're using is to educate the teachers and the staff within the schools themselves and providing any support for trainings that they are interested in. We also have those health promotion classroom presentations that I referenced earlier. And we do have within all of our clinics, they're all attached to youth clubs. They're after school extracurricular activities where these youth are dedicated to improving the health of their school community. They're partnered with our clinics themselves, and we provide support for any youth-driven overdose campaigns. We have, for instance, at Jefferson High School, which is in Northeast Portland, they also had an overdose death last year, and the Youth Action Council that is associated with that student health center worked with the health center to see what national campaigns were out there around overdose prevention. And then they They looked at all of them, and then the students voted on which one they felt was most applicable to their community and what they thought would reach their community. And then they moved forward. And with that campaign, we've had other schools where the health center's gone to different assemblies and larger groups to talk about what kind of practices they can do. We've done group education where students who are interested in receiving education on Narcan have come together and have done a group visit so that we can train them on that use. So we're trying not only to do that one-on-one education, but doing larger scale interventions and education as well. Next slide. For those of you who are curious about documentation of this, there are ICD-10 codes associated with this. Education for this is billable. So these are just a couple of different Z codes that you can use, whether that's the screening for it, if there is a history of substance abuse in the family, understanding that when kids are taking Narcan prescriptions, it's not necessarily for themselves, but for the people that are around them, and then counseling on substance use and abuse. So those are the codes that you can use. Next slide. Just dropped in here a couple different samples of the documentation that we use and some of the key points that we like to make sure that we hit. This includes education on when they're able to verbalize signs of overdose, and we do follow just that what we call the health literacy 101, which is just the teach back method. Making sure that we have students actually teach back what we do, but able to verbalize signs of overdose, when to call 911, and that they can demonstrate or verbalize how to correctly administer naloxone. We review the Oregon Good Samaritan law around naloxone use, and that you are not going to be held responsible for using substances if you call 911 on someone who has overdosed. Neither the person who calls or the person who is potentially overdosing will receive any sort of punitive action against them. Making sure patients understand that they can self-administer naloxone, offering to schedule visits for them to come back to have someone receive the training with them as well. And then we give the kit that includes the 2 doses, as well as the wallet card, the FAQ, and any other resources that they need to support them. And we talk about a follow-up plan, whether that's just as needed or potentially referring them to our substance use counselors in school, just depending on what sorts of other needs that they may have. Next slide. So our last and final intervention that we did was we have actually chosen to stock all of our clinics with Narcan to give out as same-day prescription. So the idea being that if we offer this to a student and they are interested, we can go ahead and give them that. We can give it to them and they can walk away with it same day. This works well for our particular prescribing model, since we already do this, and this was really based on principles, especially around reproductive health. We're being able to offer same-day reproductive health services, specifically around LARCs. You'll see an improved uptake on those reproductive health interventions. So we decided to apply the same to Narcan, knowing that when we have the student in front of us is often the only time that we're going to see them. So we're not ever guaranteed a second visit. So want to make sure that we get it into their hands if they show any interest. Want to call out some of the challenges around dispensing Narcan, because it is more than just having it available in your clinic. There are dispensing license requirements. The state of Oregon does require a dispensing license. This is different from just giving out like a Tylenol or ibuprofen in your clinic. But if you are going to dispense for future use rather than just administer right there in clinic, you do need to have a dispensing license. It's very easy to get, but you do have to have your licensed personnel with that additional requirement attached to their license. It's quick, it's easy, it's free, but it is an additional step that you need to do. Certainly appointment requirements, you have to have access on your schedule for this. These visits can be a little bit longer. So just having to work around those parameters, they can be done quite quickly, but depending on the age of the youth, where they're at in their learning, what kind of questions they have, what other issues they have going on, these can sometimes be a little bit longer. And so that's why we have the option of bringing them back or bringing in our community health worker, and having Narcan available to have dispensed in your clinic, requires sometimes forms of different purchasing programs. Even through purchasing programs, this can be a costly medication to just have sitting on your shelf. We currently go through the 340B program, which I believe lowers the cost to about $30 to $40 per dose, which is still pricey, depending on how much you want to keep in stock. Next slide. So whether you are doing these practices or you're considering thinking about working with one of your school-based health centers, remembering that regardless, substance use and overdose doesn't always happen in a vacuum. There can be a lot of different elements that lead up to that, but working towards general healthier lifestyles and reducing some of those social determinants of health are things that we can all work towards. But your school-based health centers are there to offer low barrier care. They are doing a lot of health promotion awareness. If you feel like this is an issue in your community or you're passionate about this, reaching out to your local student health centers and seeing what sorts of health promotion activities they are already doing. And if they're doing this, it's really nice to use a lot of the same language with our youth and to understand what kinds of information they're already receiving. Improved access to students and appointments. We partner really nicely with primary care providers within Multnomah County itself. If you are a provider here in the county or work with providers here in the county, realize that we are absolutely available. If you have students who you are worried about, or if you are having trouble getting in to see, or the students may have lost insurance, realize that we are absolutely there and available, not to take over your care, but to work in partnership with you, because we do have direct access to these students. We pull them out of class. We send them hall passes, so they can come to their appointments. We are there, right there in their clinic with them. So certainly an open invitation for partnership with us. If you would like more information on what we are doing, we did put together a toolkit designed to be used for school-based health centers that we can give out, that sort of includes some of the materials that we did as part of our rollout on these interventions. School-based health centers have a lot of community resources and may have resources that you're not aware of, such as substance use counselors in the schools, other school options, and we usually have a direct line to some of those resources or can point you in the right direction. And certainly if you have students who require additional medical supervision, your school-based health centers can really help you to partner with them. So for instance, we have kids who are coming in for everything from routine lab work that they can't get in to see their primary care provider for. We do the labs and then we send it to you. All of our services can be billed through insurance, but they are also, but we never collect a copay, and we do not collect. There's no impact on deductible. So all of our services are always of no cost to patients. Again, open invitation for partnership. I've gone ahead and just my email and my phone number are on here if anybody wants to reach out and get more information on what we are doing, or connecting with other school-based health centers in your area if you are interested in receiving any of this additional information for your community. Next slide. All right. So just really quickly, future state for us, we are working towards medication-supported recovery, or MAT. This is hopefully going to be rolling out in the next 12 months, and to be able to offer medication-supported recovery programs, hoping to partner with a couple of our community programs that already have students or youth identified that need the assistance of these programs, specifically for youth-focused MSR programs. We continue to, we do have, because we're supported by the health department, we have sustainable, low or no barrier dispensing for Narcan, and we'll hopefully continue to move through that with our MSR programs. We are going to continue to expand our school-wide promotions and health classes. The county has just rolled out an Expect Fentanyl campaign that is specifically designed for youth. And so there's advertisements for Narcan that are located on bus stops and around buses that youth use around the area. And then we're continuing to build partnerships with other organizations in the community. This is just on the next slide, it's just a picture of what that Expect Fentanyl campaign looks like, and a call out to our student health centers as somewhere where they can get this. And just a quick takeaway, I'm not going to read through all of my takeaways. You can sit with it and marinate a little bit, but just understanding that, we know that urgent efforts are needed to prevent overdose deaths among adolescents. The time where we thought that this wasn't part of our population is over, and striving hopefully to be more proactive than reactive to this has really been our goal. But we really want to focus on connecting adolescents to resources, making sure that we're educating, promoting safer drug use in a non-judgmental, patient-centered way, expanding access to naloxone, ensuring that we are using effective and evidence-based treatments and wanting to be a part of that. And so hopefully our full numbers on our research for our screening tool, that will become a validated screening tool. And just understanding that collaboration, and this is from the CDC, collaboration among public health and safety agencies, physicians and mental health and substance use treatment providers, and educators to implement these efforts can save lives. So our collaboration around this is really the critical piece. And with that, I am done. Our last slide is just a couple of different pictures of the various buttons that our staff wear around the clinic, so that we have youth who can take a look and ask us about Narcan. And thank you very much for your time. I really appreciate it.